And let me hide this. So, good morning, everyone. Thank you for being here. I am Heather Fowler, and I am appreciative that we have so many people on the call today. What we're going to talk about is extremely important. So, these slides may look slightly familiar. I had done this same consent and enrollment review webinar last August, but since we have a new policy now, I have updated these slides. So I just wanted to try to clarify everything that was in the email the other day and just make sure everyone fully understands what needs to be gathered for each enrollment. So let's just start here with, according to CMS, consent has two parts, okay? So you're going to have the initial consent indicating that the consumer has granted permission for you to search the marketplace for their application, fill out their application, provide that assistance with their enrollment. And then there's a second part. Now you do the initial consumer consent before you start anything. That's the beginning. And then after you do the application and you've downloaded the eligibility review document, then before you can enroll someone in the plan, you have this second part of the consent, which is the eligibility application review. And it's going to detail everything that was in the application. It's going to let the person see the plan they've selected, and it's going to have them agree that they understand the attestations. So there's two parts when we say you have to gather consent, okay? There's two separate parts to that, and we're going to really dig into that. Now, I'm going to send these slides out, and all of these things that are underlined are links to more resources. So this is a link to how you can manage consent within Health Sherpa, and I'm going to go over that today thoroughly because I feel like that's going to be our easiest way and probably our most thorough way to capture this. And then this is a frequently asked question sheet from CMS about consent. So, when you get these slides, click on those, look through them. It's a lot of good information there. So let's just start with what actions would require you to have that initial consent from a consumer, okay? So if you're going to collect any PII, now when you're doing a quote, if you just get their age, you wouldn't have to get the consent. But if you do the choice where you want to put in their date of birth, then that date of birth is considered PII. So you would need to go ahead and get consent if you were going to get even their date of birth. And then if you're going to search the marketplace to see if they have an application already out there, you're going to have to get consent before you do that, okay? And then, of course, before you actively help the consumer apply, fill out that application, you're going to have to get consent. Before you can enroll them, you would have to have consent. And before you can make an update, you're going to have consent. Now, if you've already enrolled them initially and they just call you back and say, hey, I need to update my income or household size, well, you already have consent. So you don't have to get that again. Okay. And then number 6, checking the status of a consumer's coverage or their eligibility application. So basically, you're just going to need to get consent before you do anything other than just maybe answer some general questions or give a quote only using the age. So I would say it's just going to be a good practice to get into, to just get that consent initially right before you do anything. If you've not been in the practice of doing that, you need to start practicing that now. Now, this is what is required of the initial consent, okay? So if you do it through Health Sherpa, all of this will be covered. If you download the document if you want to do it on paper and you download the paper consent from Health Sherpa, that's going to have all of this covered if you fill it out completely. But if maybe you're wanting to do it on a recording, then you need to make sure that the recording contains these elements. Okay, this is what CMS requires to be documented in the initial consent. Okay, and the consumer has to take, or their authorized representative has to take an action to produce this documentation. Okay, so they're going to need, if you're doing it in a recording, they're going to need to answer back. It's not just going to be you read it and them not respond. You've got to have some type of response indicating that they agree to this. Okay, and of course, the reason this is so important is if CMS gets a complaint of an unauthorized enrollment, that is a very serious accusation, and Blue Cross takes it very seriously. And the only way you can defend yourself is if you have both parts of this. If you have the consent and you have the enrollment review, and it's done according to these CMS standards, that's really the way, that you protect yourself against these allegations. Okay, so here's what the consent would have to have if you were going to try to do it on a recording. Okay, you're going to need to describe the scope and the purpose of the consent. It's someone, Lisa. Lisa, can you check the chat and make sure it, or mute?
And so there was like a bind. Where? There? No, what you call it?
Heather, this is when you can hear all the juicy gossip.
Let me make sure I'll try to mute everybody.
Mute. It's Felicia.
Oh, okay. I'll mute it too. Okay. All
there
right.
You go.
Perfect. Okay. So let's look at what if you're going to do it on a recording, you're going to need to make sure you've described what you're going to do. I'm going to collect some of your personal information. I'm going to fill out the application. I'm going to search the marketplace. Just be real clear with them what they're giving you consent to do. Make sure you have the date it was given, the name of the consumer or their authorized representative, your name, and then the process of which they could rescind that consent. If you're doing it on a recording, you're going to need to make sure you have all of these bullets covered. And then you need to keep this for a minimum of 10 years. So, if you're doing it through Health Sherpa, you're not going to have to be as concerned about this. They've already got the hard work done for you, and they're sure all of this is covered. But if you're doing it on a recording, if you're not in the habit of making sure all these bullets are covered, you may want to just have this laying to the side or have your little script that you read, something like that, so that you can be sure all of that is covered in case there was ever an allegation. You could produce that recording, you could produce the written document, or you could produce what you had sent through Health Sherpa. And we're going to begin having to do these audits as well. So you want to have that readily available to show if it's requested or to produce, I guess.
Hey,
Right.
Heather.
So yes. Hey, Lee, I'm so glad you're on here. Just jump in.
Hey, thank you. Listen, I'm not sure when the right time to say this is, so I'm just going to say it real quick.
Yeah.
Well, first of all, thank you for all the work you've done in the last week or so on developing this new process. And the thing is, I just figured hearing from a different voice to make sure that this is a point that doesn't need to get overlooked. These consent forms have gotten serious, and Heather gives y'all tons of good advice, and some of it's probably a 10 out of 10 importance, and some of it may be a 6. This is a 10, and so we're really trying to stress to people, Blue Cross, the story behind the consent forms, Blue Cross is starting to get reports from CMS. They're all trying to eliminate fraud, waste, and abuse, and they're doing it for Medicare too, but they've always kind of, been a little bit more lenient on ACA. They've never really convicted too many people. Well, they're really trying to clean that up because the expenses with ACA in general have gotten out of hand. Premiums, claims, all of it. Well, when you've got tons of fraud, waste, and abuse on top of it, the program starts to become unaffordable. And so everybody is kind of working together, the companies and the government and everybody, to try to eliminate fraud, waste, and abuse. Well, one of the big things with ACA is people getting coverage and not knowing they had it. And so, they talked about putting a $5 minimum on the premium so nobody ever had a zero. That way you had to consciously pay your premium, as being one of those barriers. Well, they're also sending the insurance companies reports. So when members find out they have coverage and they didn't know it, they call the government or the insurance company, but they call the government too. Well, the government is now sending reports to these insurance carriers with these complaints on it, and they're having to address them. And so the complaints are very specific. They're quoting the members on the complaints. And when there's a lot of, I didn't know I had coverage, or I didn't sign up for that plan, or, I live in California, or that person doesn't exist. There's so many different fraudulent ways people are getting enrolled. Now that they're cracking down on this hard, and the thing that our program, we've always taken so much pride in, is that we do things the right way. And so when Blue Cross has a new process like this and they come to it, we don't work against them, we work with them, because they're trying to do the right thing. And so they're taking this serious and they're cutting agents. And that's what people need to understand, is that if these members call in and they complain and you get accused of doing something and you can't cover your tracks, you're going to lose your contract. And we have nothing to do with it. They don't send us the report and say, hey, do y'all mind working through these and figuring out, who did what and whatever. They don't do that. They send us a message and they say, we need these agents removed from the list. And that's what they've started doing. And so if you don't take anything else seriously the rest of this week, please, if you don't have a good process for this consent form, it's time to do it. It is really important. And a lot of people are making a lot of money doing a lot of honest enrollments. So let's say you get a complaint from a member who you met with and you did an honest enrollment for. Well, if you don't have any proof of their consent to the enrollment, you're probably going to lose your contract. It's as serious as Medicare now. It used to be more like dental and vision or something, where people were just getting away with everything, and again, we never coach that. We never teach it. And we always knew it was what was wrong with the market. But now we've got to be perfect, and we've got to be crystal clear and clean on the consent form. So Heather, that's all I got. I just wanted to interrupt you real quick with a different voice and just try to beg people to take it serious. So
I'm so glad you did, Lee, because it is very serious. And the last thing we want to see is someone lose their contract, especially when they've not intentionally done something wrong. And so we just want to be sure that we've provided all the training and resources and answered any questions or walked you through it, whatever we can do to help you be able to have this, because it would just be terrible to see someone lose their contract when they really haven't meant to do something wrong. It's just been maybe a misunderstanding or a lack of documenting something properly. So thank you, Lee, for stressing the importance of it. So, there are different ways to capture this initial consent. If you want that model consent form, if you want something printed out on paper that people sign, there's a link to it. You can print that out. It will cover everything that needs to be covered. You can fill it out and then have the person sign it. And you can upload that back, to your CRM or to your Health Sherpa account, wherever you store all of your documents. But, you can also do it through a recording. You just need to make sure you have everything covered and that you could produce that recording if it's requested. And so the easiest way I think to do this, and the way that I do it, if anyone can text or they can email, is to just do it through Health Sherpa. It takes like 1 minute to do it. So this is a link to an article about how you manage consent within Health Sherpa if you want to dig into it a little bit more. But this is just a screenshot, of the dashboard. And if you go over there to the left-hand side and you click on consent, then you see this little blue button that says collect new consent. So if you have someone on the phone and you're about to search the market, you've kind of talked to them and you feel like, okay, we're going to go forward with this. Now, if you've gotten their date of birth, you should have gone ahead and done this consent before you even did the quote. Now, if you just got their age, you wouldn't have to. But just when you start to get ready to look and see if they have something on the marketplace, just say, I'm going to have to get consent. I'll have to have your birth date to search the marketplace. That's some of your personal information. And then I'll need consent to help you fill out this application and complete the enrollment. So I'm about to send you an email and you just go here to consent, click collect new consent. It's going to put a place for you to put their name and their email address, and you send them that consent, and it's going to send them an email. They just have to open it and click on it and say they type in their name and they grant consent, and then it's stored. Okay. Now, if you don't get it beforehand, Health Sherpa gives you a second chance to get it. Okay. And we've all seen this because you can't really even move forward in the application without checking one of these boxes. So as soon as you start someone's application, you're going to get this message, that CMS requires consent, and it's going to give you these choices of how you want to do it. Now, if you click down there that you have it stored outside of Health Sherpa, you're going to get to move on. But if you click that, you need to be sure that you do have it stored. Maybe you have that paper document or you have an audio recording. And right there, there's another place where you could download that paper document. If someone can't text or they can't email, you can download that and do it on paper. If you're in person with them, get them to sign it. If you collected it ahead of time, if you've already gotten it, it's in that consent library, you can pick that choice to get it from the consent library. Or you can email it or text it from this screen right here. And so they make it super simple for you and make it so that you really have to select something. So whatever you're selecting, make sure you really have done that. So when you send them the email, it's going to come from a no reply email. And that's just what I say. I'll say, okay, check your email real quick. I just sent you that consent form. It's going to come from a no reply email. And most of the time they're like, yep, I'm already on it. And all they have to do is just click grant consent there. And then this is going to be something they can scroll through and read. And then they type in their name and check this box and hit submit. And there you have it. It's done that quickly. Most of the time, it doesn't even take a whole minute to get that. Okay. But then you have that initial consent and it will be stored on their Health Sherpa page. So when you click on their name on Health Sherpa and you scroll down to the bottom, you're going to see this is a screenshot of one I did, I guess, last week. Initial consent, collect it. It's going to have the date and the time that it was done, that it was sent by email. And then if it's ever requested, I can just click right there on download and it's printed out and everything's covered. All right, so that's the first part. You have to have that initial consent. And then you go ahead, you fill out the application, and when you get to the end and you click on download the application review, you can't move forward unless you download that. Then before you enroll someone in that plan, you're going to have to make sure that they have reviewed the application, that they agree to all the tax attestations, and it doesn't say it on here, but you need to make sure they know what plan they're being enrolled in. But here is what CMS requires of the application review. Okay, this is a whole separate document from the initial consent. You've got to have the consumer has to take an action. Okay, it's not just you send it to them and they've got to take an action to say, yes, I agree to all of this. So the documentation has to, at a minimum, have the date it was reviewed, the name of the consumer, an explanation of the attestations at the end, and the name of the broker assisting them. And this all has to be stored for 10 years as well. So let's talk about the easiest way to do that. It's going to be right there on Health Sherpa. Before you can click on enroll in this plan, you have to check one of these circles anyway. Okay. Now, if you're doing it on paper some way and you're storing it outside of Health Sherpa, then by all means go ahead and check that. But if you're not doing that, then don't check it, because you're not going to have what you need if it's ever requested. And again, almost everybody can text or email that we deal with. Very rarely do we come across someone that can't do either one of those. And I just think it's the easiest to click email. You already have their email address. It's going to autofill. So I just say, okay, before I can enroll you, I need you to check over everything, make sure it's all correct. So I'm sending you an email, and I send that email, and I just sit right here on this page because they're going to need that access code. So I just sit right there. I say it's going to come from that same no reply email. And they're like, okay, I'm checking it right now. And when they get the email, it will look like this, and it will say review your enrollment details. And then they'll have to put in their name, their date of birth, and usually I'll say, two digits for the month, 2 for the day, and 4 for the year, because sometimes people don't do that. And then I'll say, and I have the access code whenever you're ready for it. And I give them that access code, and they put it in and click continue. And then they're going to see this. Now, of course, this one's for United Healthcare because it was just the sample that Health Sherpa had. Ours would be Blue Cross. But it's going to show them their plan that they're enrolling in, their premium, their, deductible, max out of pocket. And then this middle part, they can scroll through, and it's going to have all of their information that I've put in. And I always say, just make sure I put everything in correctly, because, I might have typed their zip code wrong, or I might have, put lane, Pine Street instead of Pine Lane or whatever. So, just make sure that you've typed everything in as it should be. It gives them a chance to check that. And then it has those tax attestations on there, and they can scroll through that. Now, you've already done a really good job of explaining all of that to them, before I usually start out trying to explain all of that before we even start an enrollment. But then within the enrollment, you've explained that very thoroughly as well. You always want to be sure that you have, in good, clear English, explained those tax attestations, and someone understands what they're getting into tax-wise. But this will just show that they've seen it, and then they type in their name, they click agree, and they hit submit. And then they'll say, okay, it says application review successfully submitted. And then I know that I've done that last part, and I'm clear then to hit enroll in this plan. And so once those two things are done, you're in the clear. You've done the two things that are required by CMS. And literally, it maybe takes 1 minute for the initial consent, doing it through Health Sherpa, and it may take 2 minutes, if even that long, to do the enrollment review at the end through Health Sherpa. So it doesn't add that much time. Most people are very quick on their phones. As a matter of fact, some of the young people I do, before I can even say, scroll down, they're like, yeah, I've just submitted it. So, it's very fast. I don't know if they've really looked through it the way I would like for them to or not, but most people are very quick with that, and it doesn't take long. So again, here are some links. This is a link that's going to take you to a help article that shows you how you can collect these consents and enrollment reviews through Health Sherpa. And then this is a video walkthrough done by Health Sherpa. So if you're unsure about how to do any of that through Health Sherpa, when you get these slides, click on those, look through them, and then just the next time you're doing an enrollment, practice it, and begin to try to do it that way. I think now, if you already have a system and you're collecting this and you're sure it covers everything and you're confident in it, you don't have to do it through Health Sherpa. But if you're not sure that you're getting everything the way it needs to be, I would say let's just rely on Health Sherpa. Okay. We know they're doing it correctly. And it's
Heather,
so easy. Yeah.
I wonder, I got a question. I could ask you this after the call, but it'd be good for everybody to know if we do know the
Yeah.
answer. I wonder if we can pull people's consent in Health Sherpa. So like when Blue Cross sends us that complaint
Mm-hmm.
report, I wonder if we could pull consent and send it back on behalf of the agent without having to
Contacting the
even,
agent. Mm-hmm.
yeah. And
Uh,
would that be an incentive to do it through Health Sherpa? Because if we had access to the consent, that would be awesome.
it would be. Erica is the one that has that she signs in because of doing the commissions and things
Mm-hmm.
for the admin Health Sherpa account. I've never been into that admin. So I would think if someone is doing it through the link that we sent them, the one that has your email plus the BCBSAL, if you're doing
Mm-hmm.
it through that Health Sherpa, I think we probably could get access to it. And that might be something we could talk to Chris Joyner about as well, seeing if we could get access to that. I know some
Yeah.
people are using especially if they sell in other states, they just have their general Health Sherpa account. And so I know we wouldn't be able to get it from those. But
Yeah. Yeah. Yeah.
possibly, if they're using the plus BCBSAL one, I think it would be likely we would be able to get access to that. But
Elena just texted me and said she takes a picture of her consent and then uploads it into Health Sherpa. So that's a good idea too.
yeah, that is a good way to do it. Yeah, just make sure you have it because we are going to, have to start doing those audits and they're just going to be randomly selected. So if you get picked, don't think it's because we think you're doing anything wrong or you've gotten a complaint. I really think I'm just going to take our spreadsheet and do a random number generator and see who it lands on. And, if you get picked, then you will have to provide that consent and we'll start that. I guess probably in July, picking some people, or maybe even June. We'll probably start it as soon as June. So don't be surprised if you get one of those emails. But we've not
Um,
just singled you out.
so you had Lori in the text said every time she tries the text feature that it fails. So have you had
Mhm.
anybody else say that? I wonder if there's
I
somebody she
haven't,
can contact for that.
yeah. Well, I'm sure you could probably call Health Sherpa agent support, if it's just something specific to her account that maybe needs to be fixed. I have had more luck using the email version of it than the text. So I just kind of default always to doing the email if someone has email. But yeah, I've done the text version before and it's worked fine. My go-to is the email. But if you're consistently having that issue with the text and you're sure it's not that the person on the other end is maybe messing it up or not understanding what to click on. And in this video walkthrough link or that collecting management, I think it's this top link. They show what the text will look like. So you might want to click on that. And I think I have yeah. So here's how it says, this is copied from that same help article that you're going to text it to them and then they would have an access code. And it looks like this is what the text message would say. And then it's got something that they click on and then it takes them to where they sign in and use that access code. So Lori, I don't know exactly why it wouldn't be working on your text. I would say if it didn't work through text, try it through email. And if you couldn't get either one to work, then I might would just say, hey, I'm going to have to hold up for a minute before I can submit this. Let me get in touch with Health Sherpa agent support and see if I can figure out what's going on with this, why it's not going through. And if all of that fails, what I have done in the past, because I have had some people that are in their 60s and I've enrolled them. They want to come and meet in person at the office, and they can't text, they can't email. And so what I've done is I've used that paper consent form, and they've signed that. And then for the eligibility review, when you get to that last page, right before you kind of submit everything, where it says finalize, it's in the top right hand corner. You can print that, and that will print everything that's on the application. And so, I print that out. I have them sign that, and then I think it's on this next slide. You can, at the bottom, you can use this language. The attestations at the end of the application were explained to me. So I just kind of handwrite that at the bottom and have them initial that too, so that I have that requirement of this covered, that I have it covered. I've filled out the application correctly. The attestations were explained to them. And then once I enroll them, I print out the screenshot. I do a screenshot of the plan they're in and their premium and their deductible and max out of pocket. I just print that out and I have them sign that as well. I would say it's better to err on the side of over documenting, especially if they're right there in front of you. I would just, make sure I have everything that documented so that it would just prove beyond a doubt that this person knew what they were signing up for. They understood the attestations. They understood what their premium was going to be, what their plan was going to be. So that any reasonable person, when they looked at that, they would say, this person knew what they were doing. It's left no gray area that you could have enrolled someone and they didn't know it. That's just what we want to be able to prove, is that if someone calls in and then Blue Cross calls us and says, hey, this agent has enrolled someone without their knowledge, that you could prove beyond a doubt that they knew. And, people sometimes might forget, especially if it's a zero premium plan or they're in a stressful situation when they're signing up. I know I help a lot of people that have just been released from incarceration, and maybe they're not really understanding everything fully at that time. They've got a lot going on, but still, you just need to make sure that if they did call in and say that, you can prove that it's a legitimate enrollment. They may not remember everything about it, but at the time, they knew what they were doing. Okay, so now we're getting to this email that I sent on May 18th. And so if you've not seen it, go back, find it from May 18th, because all of these little links will help you know what you need to do. So this is the new policy from us and Blue Cross that's going to be, it's, in effect already. So all ACA agents need to complete the CMS agent consent training. Now, it's going to be in the exact same place where you do your FFM training. It's on that CMS Enterprise portal. And there's a link that can take you to directions and walk you exactly through how to find it. Okay. It's exactly like how you do your FFM training, but instead of it being the FFM training for like plan year 2026, it's going to say, AB mini module consent or agent broker consent, something like that. Okay. And it says optional to the side because it has been optional, but now this is going to be required for a Blue Cross, for Blue Cross agents here in Alabama. And then once you get finished with it, you're going to get a certificate that says, that you've completed this consent training. It's going to be very similar to the one you get when you do your FFM training. But then you need to upload that to your Blue Cross portal. And I know I've gotten quite a few emails. People can't get logged in and stuff. And I'm going to go in and update all those passwords today. I've just not had time to get to everybody's. But if you're having trouble getting logged in, I'm going to work on that today. Just email me. Let me know if you can't get logged into that Blue Cross portal. But that's where you'll upload your certificate. It will say consent certificate. And I've got a screenshot in a minute to show you what that will look like. So that's the first thing everybody needs to do is that consent training, get the certificate and upload it. The second thing is that attached to this email, there is a consent and eligibility review agreement. And I've got a screenshot of it. We'll look at it in a second, but you need to sign it. And if you already have a way you can sign documents online, that's great. You can print it out. sign it, upload it back. This is a link that Lee found, and you can click on it and then upload the document, and it'll let you sign it and then download it, and then you can re-upload it. I know that's a lot of uploads and downloads and uploads, but that's just a way you can sign it if you don't want to have to print it out and you don't have another program you use for that. So once you have that agreement signed, upload it to the portal as well. And there's a spot I'll show you in a second that says consent and eligibility review agreement. That's just stating that you've completed the consent training, you understand everything about it, and you understand that you have to do it. It's required by CMS, and that you could, basically lose your contract and your compensation if that information is requested and you don't have it. Okay. And then the third thing is that auditing process will begin, and probably just some June 1 enrollments. We'll go ahead and start selecting some random enrollments and ask for those. And so if you get that email, we're just going to ask that you send both that initial consent and the enrollment review. You'll need to be able to prove you have both of those documented properly. And there are some new things that will be coming out for plan year 2028 that were just in this final rule. If nothing gets changed or halted by a court or something regarding that. But as those things come out, we'll keep you updated and make sure you know what to do. But for now, what we have talked about in this webinar is what you need to be doing. And so this is what when you go to your CMS Enterprise portal and you go down to the trainings where you would normally do like your FFM plan year 2026 training, this is what it will look like. It'll say optional AB Marketplace mini module consumer consent. That's the training you'll need to do. And then you'll need to print out, or not print out the certificate, but download the certificate that you get at the end. And if you're not sure how to get to that or anything, this is a link to directions on how you get to that training. Okay. And then this consent and eligibility review agreement, that's what was attached to the email that you will need to sign, and it will also need to be uploaded to your portal. And when you get to the portal, if you don't know how to get to the portal, here's a link. When I send these slides, you can use it, or it was also in the email. But those are directions for how to get to the portal. And I know it's quite a few steps. I took you kind of the long way around because I did want everybody to see our new website. We worked real hard on it last year, our new agent, website. So while you're there, take a minute and look at all the resources we have for you. But that is the way you can get to this portal. And then here's where the consent agreement, the one that you sign, that's where it will go. And then the CMS consent certificate that you get after you complete the training, this is where it will go. And then you do have to click update or it won't save it in there. All right, so what about questions? I know I've gotten quite a few, emails, and I've talked to several of you, and I appreciate so much how seriously everyone has taken this, and the response has just been great. So I appreciate all that. Everyone's working really hard and making sure they're going, wanting to make sure they're doing this correctly. So, if you have any questions, feel free to ask right now. I'll try to clear anything up, or after you're going through it, if you have any questions, reach out to me. I just want to be able to provide you with any resource or any help that you need so that we're never faced with this situation again where someone, could possibly lose their contract due to an allegation when it's no wrongdoing intentionally on their part. So, does anybody have any questions or anything to add or say? Lee, do you want to add anything? I know we've run over just a little bit. Okay. Well, if not,
I have something real quick.
Okay,
Kelly.
thanks, Paul. Yeah.
Many of us are going to Medicare Pro.
Okay.
And Medicare Pro has in their approval consent forms right now that you can customize. And one of the things I like about theirs also is you're asking for the household, they're sending in household, and they're sending income into you. So before you even quote, so you have that in there. and they will be updating it to go with the next one. So if you have Medicare Pro, you can send that out to someone as a client portal. They'll send it back in, and you've got that in there, and you can upload it in there also into Health Sherpa. But I like people telling me what their income is.
Yeah.
So you're not just guessing it. You have that in document too, because they can't ever come back and say, "Oh, I never told you I made that much," when they have the 1095 and they owe money. So Medicare Pro, if you're using that, it'll save those in there for you. And you can also, if you have Ring Central connected to that or one of the other ones, the recordings will be saved in there also. So you can actually record talking to the person, and it's saved in your Medicare Pro too. So
Oh, that's great, Paul. Well, we've just gotten both of those programs at the office, and I've not really explored those, but that's great. I'll look into that more. Thank you.
yeah.
Yeah, we may even get you one day to do some little demonstrations on some things for people that have those, so that we know how to use those better. I see some things in the chat. Lisa, have you monitored the chat? Is there anything that we need to address in the chat?
I don't think that there was anything that we missed. I think everything was just kind of comments.
Okay.
But everybody did say thanks for all your efforts, Heather, for keeping them compliant. Carolyn did ask, what is Medicare Pro? And Carolyn, Medicare Pro is a CRM that a lot of us have gone to using. We haven't mastered it here at this office yet. We're working on that. Paul Todd has, Paige has, but it is a great program to start using. And Paul and Paige are great at it, and we love it. We're learning it, and it does a million and one things and is wonderful. And that's what that is. So if you don't have a CRM, it might be something that you want to look into.
Okay.
She asked, how do we get it? Well, you go to Medicare Pro. I think it's just MedicareProApp.com. Is that where you go, Paul Todd?
Yeah. Yeah.
Yeah.
And AL NABIT is $10 off.
Okay.
So it's $35 a month, works for both Medicare and ACA.
Yes. So that's the good thing, is it does work for Medicare and ACA. So to keep up with your business. And it's just MedicareProApp.com, and you can go in there and sign up, and it's $35 a month. So it's wonderful. If you want to know a little bit more about it, you can call Paul Todd or you can call us, and we'll give you a little bit more information. But you really just kind of have to go in there and play around with it and see if it's something that works for you. But I think it will. But Heather, everything else, I think you answered all of the questions. I don't think that we missed anything. Alicia was just kind of commenting on the things that Lee had said, and everything else were just questions that you answered.
Yeah. Okay. Well, thanks everyone. I appreciate everyone's cooperation with it. And, we're just going to get better and better with it. And if you have any questions, just give me a call. I'll be glad to help you. So, well, everybody have a good day.